British Columbia is the first and only province or territory in Canada that has taken over our healthcare services for First Nations peoples.
Our job is to try to get what I always call boots on the ground, resources into the community. We create the space for the communities. They step in and do what they need to do to help their own people. Well, the 10-year strategy is a framework for transformation, and it's establishing a foundation for healing for our people. Well, directive number one, and this has been from the get-go, and the Health Authority and Health Council established itself, is community-driven, nation-based, and that's all about self-determination. So we have to reestablish our own healing mechanisms and our own processes. It's really not about what outsiders are going to do, it's what the community wants to do in terms of their own health. Well, it's really important because the current healthcare system is not working. It is actually broken, and we can't fix it from the outside, so we have to reestablish our own healing mechanisms and our own processes.
We know that the chiefs and leaders of the province are the title and rights holders. They're the ones that work on a government-to-government relationship with the province and the federal government.
It's really not about what outsiders are going to do, it's what the community wants to do in terms of their own health. So our job is to not transmit intergenerational trauma, but to transmit intergenerational healing.
In 2005, First Nations from every region of BC came together to envision a health system by and for our First Nations peoples. A health system with a focus on wellness rather than illness. A system grounded in culture and tradition. These leaders formed the First Nations Health Council, a group of representatives from each region whose goal was to listen to our communities and to advocate for better health outcomes, directly accountable to chiefs and leaders. Health directors from every region voted to create the First Nations Health Directors Association to provide technical advice from the perspective of communities. In 2011, First Nations leaders across the province came together at Gathering Wisdom to sign a historic agreement, one that enshrined those values and empowered First Nations in BC to participate fully in decision-making about their health and wellness. In 2013, the First Nations Health Authority was created as the first province-wide health authority of its kind in Canada, a health and wellness partner to more than 200 diverse First Nations communities across BC. With this framework in mind, the community gathered to outline 7 directives for First Nations health governance, as part of the creation of our own health governance structure. Among these are the directives to be community-driven and nation-based, and to be without prejudice to First Nations interests.
The component that's really important, I think, is ceremony or spiritual, because my understanding and what I know is that our ancestors, before contact, put down prayers and ceremonies for us to pick up. And whatever that looks like today for the different nations, that's what's going on. They put those down for us, and now our job is to pick them up.